Well, kia ora tātou everyone, and welcome back. I hope you've enjoyed your afternoon tea, and so it's with great pleasure that we are going to introduce the Minister of Health, the Honourable Dr. Jonathan Coleman, who, as you probably know, entered Parliament in 2005 and has been in Cabinet since 2008, taking up the very straightforward, uncomplicated health portfolio from his predecessor, the Honourable Tony Ryle. So as you know, the Minister has an extensive background in health, medical qualifications himself, and also has practiced in primary care and some experience in a number of overseas places as well, including the UK. So I was just explaining that we're on a very constructive and positive journey. This isn't the beginning, but it's an important waypoint as we move from lofty ideals to implementation and contracts. So Minister, with that introduction, I'll ask you to address the meeting. Thank you very much.
Well, kia ora and good afternoon, everybody. It's good to see people here from such a wide range of backgrounds, but also, of course, you have a very common interest in the future of pharmacy and integrated services. So thank you, Ian, for the introduction. I want to acknowledge especially the consumers who are in the room because we really, as a government, are looking at designing services around what you want. And that is going to be a major theme across the public service, not only in health, but in the whole raft of services that the government funds. So we're taking your feedback very seriously, and I think it's great actually that we have you here for a forum like this. It's a beautiful day outside, so for those of you who are not from Wellington, of course it's like that here all the time, but do try and get out and about and enjoy something of what the city has to offer. Ian mentioned my role as Health Minister, and I just realised talking to him that we're both retired doctors, so I know that his background helps enormously in the sort of facilitation he does, but I can tell you it's also ironically a great background, not only as Minister of Health, but a great background for politics, because medicine means that you're used to dealing with people from all walks of life. You're also very used to trying to impose some sort of structure on ambiguous situations with variable outcomes and putting some sort of order into what can often be a situation of chaos, and that very much is the day-to-day life of a politician. But it is an enjoyable job, and the reason for that is you're very engaged with your community at the local level, and then you come to Wellington and you have the opportunity to, really shape the direction of national policy. You will have seen this week, of course, that that's not always an easy discussion. So I was out there on the forecourt of Parliament on Monday meeting with patients with metastatic melanoma and talking with them about the challenges that they face. And at the government end, we have a real challenge making the money provide all the services that benefits the greatest number of New Zealanders. But in terms of melanoma, I think actually a funded treatment is not too far away. But as I made very clear, I think it's also very important that politicians don't reach in and interfere with the Pharmac model, because if we did that, you'd suddenly find that area being used as a political football, and actually we wouldn't get the gains that we need overall. So anyway, this is a great time for this forum because we're about to release the New Zealand Health Strategy. That is coming before Cabinet quite soon. Some of you will have heard me say this before, but when I became Minister I was quite surprised to find that actually there wasn't one place where you could find an overarching strategy for healthcare in New Zealand. And so that also sits alongside the draft Pharmacy Action Plan, which many of you will have been engaged in. And this forum is going to help build on previous discussions about how we have more integrated, innovative pharmacy services, as I say, with the patient at the centre. And innovation in health is going to be incredibly important. We deliver health services very differently now to how we did 20 years ago, but I tell you it's going to be different in 20 years from this moment. And constant innovation, looking at how we can deliver services better, and looking at how we divide or develop more personalised services, increasingly delivered in the community, is going to be absolutely crucial to delivering on the health needs of New Zealanders. Overall, I think the health sector is in good shape, and that's the feedback I get going around the country. Obviously it never feels like there's enough dollars in health. Not one person on my travels has said, we've got enough money, don't send any more. So I don't think there's any danger around that. But if you look at the government's spending on health, we've increased it by $4 billion over our time in government, so from nearly $12 billion to nearly $16 billion. We're spending $1.7 billion over the next 4 years, and that's to cover new initiatives, but also to meet cost pressures and the growth of our population. So luckily, health inflation and inflation in the general economy has been pretty low over the last couple of years, so 0.1% last year. But we do have this challenge with our ageing population. So we're all living longer, which is a good thing, but we've got to work out how we provide healthcare services for people. At the same time, people are wanting to live in this country. So when I was Minister of Immigration at the start of the government, immigration was pretty much in a net balance. We're now positive 60,000. And in actual fact, when we looked at our figures for this year, we've actually got another 107,000 people in the population that we've got to provide services for in this coming year. And that's due to a combination of things. It's immigration, it's Kiwis coming back, and it was also a little bit of an undercount by Statistics New Zealand last year. So you can see that there's always going to be more to do. In terms of unmet need, that is a bit of a political hot potato. So we're doing more all the time. There's more operations, an extra 50,000 operations per year, an extra 110,000 specialist appointments. But there's no doubt we've got to keep on doing more and more and lifting our sights. So we're never going to get to the point where we say the job is done. One of my key priorities is to focus on prevention and early intervention. And that means early access for people who need health care. I've made it clear to DHBs that I expect more services to be delivered in the community, and we've got to continue to change the way that healthcare is delivered. We've got to have more people treated away from hospitals. We've got to have greater progress on non-communicable diseases, and of course chronic conditions put the largest burden on our health service and our budget. We've made great progress actually on smoking over our 7 years in government, basically by hiking the taxes up pretty effectively, but there's a number of other things we need to do, because if you look at smoking, which is actually, as we all know, probably the number one thing you can do to improve your health overall is to stop smoking. We've cut the rates by 25% over 7 years, so it's pretty good overall. But in Maori women, we've still got 50% smoking. So you can see through that statistic, it illustrates the challenge we've got in the health system. We're making good gains in some parts of the population, some parts of the geography of New Zealand, but we've got to work out actually where there are health inequalities and what interventions are needed to make real progress. Childhood obesity has also been a pretty hot topic, and that is something which we need to make continued progress on. There's no one silver bullet that is going to solve that issue, and we considered very carefully the range of interventions, and we considered how we could best spend our money, and also, frankly, what was going to be able to be implemented in a way that took the vast majority of New Zealanders with us. But one thing that didn't get as much coverage as I think it should have is that we now have a target around childhood obesity. That's one of the 6 headline health targets, and so that really indicates the political importance of this. And I think you're going to see further debate internationally over this subject for quite some time to go. So I was talking about the health strategy. Now that's got 5 themes. So it's people-powered, it's delivering care closer to home, it's a focus on value and high performance, it's having a smart system, and it's emphasising one team across the health sector. And I came into this job saying to clinicians, to administrators, to people in governance, and actually consumers are included in this, we are all focused on the same higher goals for health in New Zealand. And it's important that we're able to sort of raise our head above the parapet and get away from the inevitable tensions that will arise, but focus on what's the bigger picture and are we making a difference to improve health on a population basis in New Zealand. So the themes in the strategy signal a focus on prevention and wellbeing. They talk a lot about more integrated services, They talk about innovation, better collaboration, and new ways of working to reach the most vulnerable, and very importantly, giving every child a healthy start and making sure that information and services are more accessible. So that is going to be the blueprint for the next few years, and a big part of that actually is going to be a new approach to health IT. We've got a very fragmented system. It really does affect productivity in the system, and if you think of the flow of a patient through primary care and into the hospital system, the multiple points at which people have to recount their history, the multiple points at which mistakes can be made in the recording of a history, and also the lack of control that consumers have over their health records. It's quite clear that if we can get a unified system so that if you are skiing down in Wanaka and you happen to break your ankle and you need hospital attention, when you're flown to Dunedin, they can access your records in Wellington at your GP and have a far more seamless and better experience for you. So anyway, that's what we're working towards in broad terms. I mean, more specifically here, pharmacists are right at the front line of healthcare delivery, and 1.3 million people every month visit a community pharmacy. So that's often the most regular and easily accessed point of contact. And that's why our highly skilled pharmacy workforce has a major role to play in this new health landscape. So, as I said, if we're going to meet rising health demands, we've got to work in a different way to meet the needs of the population. You're all familiar with the burdens of diabetes, heart disease, and dementia. And I'm keen to see if we can further utilise the skills that we have right across the healthcare workforce, and very specifically in the pharmacy workforce. And I don't think that the current system makes enough use of the skill set of pharmacists. A lot of pharmacists are mainly focusing on the supply of medicines, but the profession has much to contribute to the safe and effective use of medicines and the reduction of medicines-related harm. There are a number of projects that could be more widely used. For example, having more pharmacists routinely providing flu vaccination or helping more people manage long-term conditions, as well as better use of prescribing technology like e-prescribing. Because pharmacists see these chronic patients on often a weekly, if not more often, basis. And I think there's scope to actually really use that part of the healthcare workforce, not only for better outcomes for patients, but to take pressure off other parts of the system. As I said, the draft Pharmacy Action Plan aligns closely with the health strategy. The draft Pharmacy Action Plan has been developed over several months, and it offers an opportunity to define the future direction of pharmacy and the range of settings in which pharmacist services are delivered. The consultation process provided useful insights into the future of services and opportunities to expand that role for pharmacists. We know also that consumers are increasingly wanting to take more control of their own health. They want transparency, not just about costs, but also around what services are available for them so that they are able to make informed decisions. Closer integration of pharmacist services into healthcare teams in primary, secondary and tertiary settings is a unifying theme in the plan and ties very closely to what we're saying in the health strategy. The plan will set priorities for actions that can be implemented at national, regional and local level over the next 5 years. It sets out how we can make better use of the knowledge and skills of pharmacists in a number of ways. We want to see pharmacists providing public health interventions that enable people to stay well. We want pharmacists working collaboratively as part of an integrated team to deliver a range of medicines management services. We want patients to have timely access to self-care advice, to treatment of minor ailments, and we want to better manage acute demand and have appropriate referral made in a more timely manner. We also want to see more effective use of the workforce and technology to streamline the dispensing and supply process. Prescribing pharmacists can contribute to better health outcomes by improving medicines management. And in summary, the plan clearly signals the intent to maximise the skills of pharmacists for the benefit of New Zealanders. I know the pharmacy steering groups provided valuable input to the draft plan, and I want to acknowledge the work that's been done. The group supports an approach to make better use of the capacity and capability of the workforce. Better use of the pharmacy technician workforce, including implementation of the pharmacy accuracy checking technician role, is also a key area, and that has the potential to further free up the time of pharmacists. There's quite a lot of innovation happening in the pharmacy area across district health boards. One example is the Bay of Plenty mobile clinical pharmacist services that have been developed in response to increasing concerns about medication errors, medication-related harm, and the increased morbidity and costs associated with less than optimal use of medicines. There's also work going on in Hawke's Bay and Canterbury, and many more innovations across the country. E-health solutions are an important enabler of providing care closer to home, driving efficiencies in our supply model, and freeing up pharmacists' time. In the future, the wider healthcare team will be able to access, contribute to, and share relevant clinical information that's going to form part of each individual's personalised electronic health record. Pharmacists will be able to use available technology to provide flexible solutions and services. For example, the use of robotics for dispensing activities and other smart technology to provide timely advice and services. And that can considerably improve access and have a positive effect on the delivery of services in remote parts of the country. One of the aims of the CPSA when it was introduced in 2012 was a more patient-centric model. We've made pretty good progress, but there's still a lot more that we can do. And one lesson that's been learnt through that is the need for engagement. As I said, discussions can be tough at times, but I want to acknowledge the collaboration that has taken place between pharmacists, their representative bodies, the district health boards, and the Ministry of Health. And I look forward to the outcome of the current CPSA negotiations. So anyway, I once again want to say I appreciate you all coming here to Wellington for this forum. I'm very pleased about the cross section of people with an interest in the sector that we have here. And I'm really interested in what comes out of this in terms of advancing the contribution of pharmacy to a truly integrated healthcare system in New Zealand. And I'm very happy to take any questions you might have. So thank you very much, Professor Town.
Good, so we do have a microphone, and we'll ask you just to say who you are and then ask your question. Thank you, Buzz.
Thank you, Minister. Buzz Burrell, currently a GP in Renwick. And
I've met you before, Buzz.
You have indeed.
Yep.
Nice to see you again. I'm going to play devil's advocate because I actually agree with everything you've said. However, I'm wearing an NZMA hat. I'd like to ask you, how do you see, or what advice can you give us, such that the GPs will not be threatened by an initiative which comes forward from here? Because to a certain degree we could be forgiven if we think that any initiative is simply just going to take money out of our pockets, and that will threaten us to bits, and if we're not careful we'll have a backlash from the GP saying no and opposing anything that happens. So what advice can you give us so we don't do that?
Well, I think the two things are there's money and there's workload. So obviously money always has to be worked through. But look, I think there's going to be plenty of work for everyone in the health system. And I spend a lot of time actually talking with Health Workforce New Zealand about the problems in servicing certainly regional parts of New Zealand outside the main towns in those regions. So I think the key to it is clear communication about what this involves. We're not going to make sudden radical moves. The forecast for the primary care sector is actually we're going to be under-doctored. The fact is we're producing more graduates, but we've got to get them into the right part of the country. So I don't think doctors should be threatened by this at all. The feedback I get from most doctors, once they frankly reach about the age of their early 40s, is they want more options, they want more flexibility. And I think working more closely with pharmacy colleagues can actually help free up their time to do other things, not only clinically, but frankly, allow people maybe to work fewer hours. So if you look at the well-publicised case of the gentleman in Tokoroa, who's seeing 43 patients a day and can't get someone to come and work for $400,000 a year, I'm sure that doctor, I bet he would love to be able to share some of his workload with a pharmacist. So in the end, I think it's right that the NZMA raises concerns to be worked through, because, you don't just want this steamrolled through and then, we can sort of repent at leisure later. But I think there's a way that we can meet everyone's concerns And as I say, I think there'll be plenty of work for everyone. On the patient safety side, things are going to be very controlled in terms of we're not just going to have things happening whereby pharmacists have to take on more responsibility than they feel comfortable with or indeed are trained for. Yep.
Other questions for the Minister?
Well, that's okay. I'm fine with that. Yeah, I get questions all day, so I've just had a whole blistering series of them in Parliament, so having a happy audience. I presume you're happy or partially happy. You're certainly not hostile, so
a pretty easy ride,
I'll take that.
Yep. So Ken, I thank you very much for making time to come up today. We have a very constructive conversation underway, and I'm sure your team will feed back some of the outcomes of today's meeting. So thank you so much.
Good to meet you. Thanks very much.